Stakeholders in the health sector have insisted that data is essential in shaping government decisions and policies. Speaking to Newsmen, Director of Program Quality and Influencing at Plan International Nigeria, Helen Idiong, said accurate data is needed to back up claims and push for policies that benefit the people.
So I think that we have made a lot of progress, but we can be better. We can do better than we are currently. In some areas, you look for data you may not actually find. In some, you will find. Like I was saying today, who knows the impact of the 100 girls that are about to be married off in Niger State? What can we say about the state of the girls in a particular location in Nigeria? We don't have those up-to-date data. And for us, that is something that's very important because harmful social norms hide and thrive when we don't have enough data to back it up. We have been talking about issues that have to do with girl-child marriage. So far, we find out that in Nigeria, globally, Nigeria is like the third, we have the third highest number of child brides. And you know, for children that are married early, issues of obstetric fistula, VVF, and all of those things. We are also perpetuating intergenerational poverty. And so these are things that we need data to be able to tell government that, look, this is what happens when you marry off young children. This is what happens when girls don't have education. And so for us, it's not yet there, but the Federal Ministry of Health is really trying, and this is one of those times that they're trying, looking at how to keep reviewing their data to be up to speed. So that's why we are really in support of what they're doing.
Also speaking, Dr. Chris, Director of Planning, Research and Statistics of the Federal Ministry of Health, emphasized that data is crucial for measuring progress and reporting on indicators. On his part, Adeola Jegede, Head of Planning, Monitoring and Evaluation at the National Institute for Pharmaceutical Research and Development, added that the meeting aims at ensuring the availability of current tools for relevant data collection.
Process that is usually undertaken to harmonize all existing tools in the health sector. And the process is aimed at either including new data elements or indicators or expunging indicators and data elements that are redundant, that are not being reported upon. Essentially, that's why we are doing this. And then the goal is to have tools that will be able to collect and report health intervention holistically to the national reporting platform, which is the DHIS2 platform.
There are a lot of gains of the NHMIS. One, it gives you opportunity to have real-time data for decision making. There are various activities that are being carried out and various interventions by partners and by governments. If the leaders and the managers of the health system don't have the information to reflect on what has been happening to be a challenge. So the NHMIS is a system that is helping the country to ensure that it has relevant data to ensure that results are taken real time. For example, if there are outbreaks, you need to have surveillance data. If surveys are done, you need to have that so that even as a country we can report to ourselves and to the international community of what Nigeria is not alone. So we are in the Africa region and we're also in the global space. So we need to have right information at the right time to ensure that the right things are done. And I think that is the focus of the current government and the current ministers.
Participants at the workshop agreed that accurate data is essential for addressing generational poverty, adhering to Child Rights Act, and making informed decisions in the health sector. They urged the government to prioritize data collection and invest in tools that can provide reliable and timely information. Florence Joshua reporting for Clearview News Desk.